Welcome to another episode of Wild and Well. Today I'm talking to pediatric speech pathologist. Look at my speech here while I'm speaking to a speechy, Rita Shamoun, about how we can support our kids in their speech and their communication. So, welcome, Rita. I am really excited to talk to you. I think that so many of our ideas are so aligned. But before we get into all of that, can you tell us what you've done today to take care of yourself?
Well, as I just said before, I went out for a dinner last night and I came home a little bit late. Did I choose to sleep in? No. I woke up early, went for a gorgeous walk in the sunshine and enjoyed a cup of coffee in peace before I returned back home to the manic, as many mothers return back home to the manic in school holidays because it's school holidays here in Australia. The children are hungry, the washing baskets are full, but I looked after myself this morning just by a simple walk and a coffee.
It just has to be those simple things, right? Like we don't have to be
Yeah.
complicated with it. That makes such a
No,
difference to how the rest of your day is going to go.
100%. 100%.
So can you tell us a little bit about yourself and what it is that you do?
So, my name is Rita Shamoun. I am a mum to three daughters. Sophia is 12, Maria is 10, and Tonya is 8. It's a very busy household. My poor husband's outnumbered, but we're building, we're supporting strong future women. As a career, I'm a pediatric speech pathologist. I treat young children under the age of 7 and I specialize in early intervention. In my clinic space over the years, I work with so many mothers, same with you, Hilary. And I've noticed the need of their emotional well-being, their physical well-being, and more their mental well-being not being addressed because they're caring for a child with additional needs. And when you hear those conversations and when you hear the concept of, I feel so isolated, no one understands what it's like to raise a child with special needs or additional needs. I was then inspired to create a podcast where we share stories of what's it like raising a child with additional needs. And in my years of being a speech pathologist and the podcast, which is called Wine with Wheater, it's so special that when you hear someone sharing a lived experience, you become relatable to that person. You feel like someone's understanding me. I can finally travel this journey without feeling alone. And the more that we share these stories, the more that we advocate for our young kids, what happens in return? Parents feel empowered, parents feel motivated, and parents then know who is their community to keep going because their day to day living is quite challenging. And sometimes that isolation does impact them significantly. And like everyone else in the planet, we all want to feel a sense of belonging. We all want to feel heard. And in my own capacity, that's where I created Wine with Weeda to let others' stories share and help someone else too.
Yeah, I love that. And you're so right. Like I think all of us generally, there's this isolation that is really normalized in our society. We all live in
Mm,
our houses and we're all, talking and working often at home and talking over the computer. And then you just add that children with special needs and additional challenges, and it can just get so overwhelming so quickly,
it
can't it?
does. It does. And I guess even when we reflect to when we had our own children, no one ever anticipated having a child with additional needs. We all shared the same optimism and excitement once we got that pregnancy test on, and it was that the double line or the blue line. We all were excited to buy the gorgeous new pram, decorate the baby room, have baby chinos, go to ballet lessons with our daughters or soccer lessons with our young sons. But sometimes those hopes and dreams are shattered because of the child's difficulties. And that's the most important part. We need to recognize and support parents through this journey and guide them to how they can reframe their new life with their child.
Yeah, absolutely. And I really want to get into some questions about
Yeah,
speech pathology,
absolutely.
but I want to stay on this for a moment because
Mm.
I want to know what you do to support those families and what do you recommend that if somebody is listening, what they can do if they are feeling isolated or overwhelmed or grieving in that experience. And I think your
Yeah.
podcast is a great resource for that. But yeah, what else can we do?
Mm. I feel like in my years of being a speech pathologist, and even when I reflect to when I first started my career, I was that speech pathologist that would have all the strategies and put that expectation on parents. No dummies, no TV, no screen time. But then when I became a parent and my daughter had challenges in her early years, it made me reflect on the kind of clinician I wanted to be to support a parent. Because when you're building that gorgeous rapport with a caregiver, you're building trust. And how can I show that I'm on the team on the same side as the parent for them to listen to my advice and to implement the strategies that I'm putting out there? And it goes far beyond me telling them. It's by me showing them that I care and showing them that I matter and creating that community. So, if you're a parent who has a child with additional needs and you are feeling isolated, my first recommendation would be don't be afraid to ask for help. And it is so hard because our ego gets involved, right? That I can do this. I've been given this child. I can do this for my child. But even if you simply ask, can you grab me a coffee through the drive-through and drop it outside? That would take that extra burden off you. And by asking for that help, one less task is needed for you to do. And your day is that little bit better. So that's the first bit, asking for help. Second bit is find your community. When you find people that are sharing the same lived experience as you can have those healthy discussions and ask those questions that you are too afraid to ask other people. But when you ask others, such as, does it get any better? Can you recommend other people? Can you tell me what else I can do? What does that happen, Hillary? What happens to you? You feel, wow, someone understands me. I feel like I've built a beautiful, safe place with this person. And when you have all those emotional needs met, in turn, you are actually interacting better with your child. And when you're interacting better with your child, you show them, I'm your safe person. I can then implement the strategies that the speech pathologist, occupational therapists have told me because someone else has told me that is working.
Mm.
Yeah, and I feel like it goes way beyond the prescriptions we give our patients. It's about showing them that they matter. And when you show them that they matter, that trust then helps them believe that they can. And when they can, they then in turn show their child and help their child far more than what they did initially.
Yeah, I was nodding along the whole time you're saying that because it's
Mm,
so true. We have to, number one, start practicing asking for support because it isn't a skill
mm,
that most of us have. And like you said, our ego totally gets in the way and we think I should be able to do this all myself. That's ridiculous. We need to get rid of that
mm,
myth. And two, if we are supporting ourselves and whether it's with community or like all other aspects of like healthy living, we can show up so much better for our kids and implement
yeah.
whatever the strategy, whether it's speech pathology work that we want to do, or it's helping your kid learn to read, or whatever. It's just so
Mm-hmm,
much easier to do anything with our children if we're
mm-hmm.
coming from that grounded, filled up place.
100%. And I think in the world, there's just so much noise. There's so much noise of what a diagnosis looks like or how we have to help our child communicate. And then there are influencers that have a child with additional needs and they show what works with their children. But I want to really emphasize here that their strategies that they're implementing are wonderful, but it might not work for your child. And when you feel sometimes disheartened that your child's not responding to the same way that child on the Instagram or TikTok is responding, and then you just feel really uncomfortable within yourself. So I always tell my parents, don't look at what the other people are doing. Look at what you and your child can do together. And if that means, I don't know, painting toenails green or pulling grass out of the garden or even simply building blocks, that's okay because that's where you're fostering a beautiful relationship with your child. And that's all that matters.
Yeah, it really is. That's
Mm,
foundational, isn't it? And in the
mm.
end, like that's all that matters is that
That's all that
relationship that you
matters.
have.
Yeah,
Yeah, I'm working
100%.
on my picky eating book right now, and the foundation of that work that I do, and like I'm just reviewing some of the chapters. The foundation is that attachment, that connection, that
Yeah.
relationship that you have with your child. It's
Hmm.
everything.
That attachment starts way before the baby's born. And in the years that I've been working to myself, my own self-reflection, it's how you work on yourself as well to know how you recognize yourself in your child. And I find it so fascinating that with my eldest, I see my eldest's challenges. They were my challenges. And I feel it's my responsibility to model to her healthy ways so she doesn't grow up to be the young version of me as she gets older. It's so fascinating.
Yeah, it is. Parenting
Yeah.
is an incredible self-development tool if you let it be one.
Yeah. Yeah. 100%.
So, can we talk a bit about what a speech pathologist does
Yeah.
and like what does this look like in your day-to-day work with children?
So, as a speech pathologist, we can treat both adults and pediatrics. I chose to go down the path of pediatrics because, let's face it, working with young kids brings us joy. And when we're happier, we've got more fulfillment in life, we feel more excited. And nothing, I think, makes me feel more happy knowing that I can support a child find their voice. And it gives me great purpose. So, that's the reason why I became a pediatric speech pathologist. As a pediatric speech pathologist, we support kids with their language. Now, language is divided into two sections: receptive, which is a child's ability to understand, and then expressive, which is their ability to express what they want. Then there's speech production. A lot of people get speech and language confused. Language are the words and sentences and grammar and other areas. Speech is the sounds that are the sounds that we make, such as p, b, t, so forth. So speech production is a big area we work on. Then stuttering is another area, so fluency. Another area would be pragmatic social skills, which is associated a lot of the time with language. And then it could be swallowing. Swallowing for a child is you might be associated with your Picky Eating book. You might know some tips there. And voice disorders with children as well. In my case, I specialize with young children under the age of 7, and my caseload is predominantly focused on language and speech production and children with developmental delays and communication delays too. What does my day to day look like? It looks like navigating a world with parents who are confused with their child's diagnosis and supporting them to understand what does communication mean. Now, the term communication, many people think it's immediately the words and sentences that come out verbally, right? But it's far more than that. It's about understanding how a child is communicating non-verbally through their behavior, through their gestures, through their actions, and so forth, which allows us to understand what communication is. Yeah. And then once that penny drops for parents, the whole dynamic changes because it lets them understand the capacity in which their child is communicating and invites the parents into their world so they can support their child rather than us expecting the child to enter the parents' world. Yeah. So that's my day to day. And a lot of that involves play. Research shows that when we understand a child through their interests, follow their lead, and through play, they learn substantially much better than having the expectation of having flashcards and telling a child to say a word. So yeah, that's my day. A speech pathologist, I support kids with their communication, and then we develop goals with parents and to eventually discharge where they no longer need me to support them because they're communicating effectively out in the big bad world.
And how long do you normally work with a child? Is that very dependent on their situation or?
Yeah, so it's changed quite here in Australia. So in my early years, many children would. There's a lot of financial capacity here too. So parents would stay till the child is actually just communicating and they're understanding their needs and wants, and they would just stop treatment or access another service. But now we're very fortunate here in Australia to have a scheme called the National Insurance Disability Scheme. It's called NDIS, and it's funded by the government where parents can use those funds to obtain services needed for their child. So fortunately, a lot of these kids stay with us now for much longer because they have far more complex needs as they get older, such as social skills, learning how to access the curriculum for school as they're older. However, the downfall of that, when a child is with a clinician for over 3, 4 years, other children miss out or they're on the waiting list for a very long time. So we're very blessed from the financial perspective, but on the flip side, if children cannot get this scheme, parents are waiting forever, and which is why I also had Wine with Weeda to share strategies that parents can just start to use as they're waiting, because something is always better than nothing.
So can we speak about that a little bit with like early intervention? Like why is it better if we start early with intervention and what does that early support really look like?
Yeah. So the research does suggest that starting that before the age of 3 years old for a child has significant positive outcomes for a child. And if we try to understand what that means, typically for a child that's 1, they're developing their single words. So just imagine your 1 year old. By 1 to 18 months, they're using single words such as ball, bottle, mum, dad, car, everyday words that they would be involved in their everyday interaction. So that's the expectation for a 1 year old. By 2, all those gorgeous words that they're starting to use then become shorter phrases, such as mum, car. And they could be pointing like mum, come to the car. Or they start to develop other kind of words like doing words, place words. Mum, sit on chair. Yeah, see the different change of the sentence. As a child gets older, by the age of 3, developmentally, a 3 year old typically needs to be using 3+ words in their phrases and sentences. So if a child isn't communicating by the age of 2, 2.5, they've missed a large chunk of developmental milestones. So if the child doesn't talk before 4 or 5, and they're not even using single words at that point, there's so many milestones that they need to develop before they get there. And this is why we stress early. Starting early, there are technically less milestones to achieve, but the brain is so, what's that word, malleable? What's that word? Is that the word?
Valuable, yeah.
I call it Play-Doh with my clients. Like it's so soft. And a child is able to learn, especially because their goals are much shorter and easier to target when they're much younger. And by that point, I want to make a comment. By that point, a lot of children haven't developed behaviors as their form of communication. So many of the time, parents come and see me when their child's biting a child in the daycare center or having many tantrums on the floor. I said, I believe your child has communicated to you much earlier, but they've learnt this is the fastest and most effective way to get what I want, right? So if we can understand how a child is communicating much younger, understanding the capacity, we can support them to limit the likelihood of them becoming aggressive or them harming themselves as their form of communication.
Yeah, it's so much easier if we can improve anything when they're younger because like you say, they
Mm-hmm.
are more malleable or like there's so
Play-Doh,
much
Play-Doh.
Play-Doh. I love that. I'm gonna start using that. And then they don't build like unhelpful habits like that biting or beliefs about themselves that they're not
Mm-hmm.
able to do something or they're no good at something that can
Mm-hmm.
layer on and make it more complex and
Mm-hmm.
have it change how they see themselves.
Mm-hmm. Absolutely. Absolutely.
So, what are some early communication or oral development red flags that parents need to know about?
Yeah. So before a child can say a word, we need to understand or examine, can a child understand a word? So first point of call, can they understand when you're calling out their name? Do you need to repeat their name multiple times for you to get their attention? Do you need to do you need to move closer to them? So that capacity says to me, okay, the child isn't responding to their name. You're always repeating, so you're supporting and they're not engaging. what's going on there. So that to me is a first red flag. Second red flag is their interaction with other children. Are they imitating others during play? Are they inviting other children into their version of play? Or are they solo by themselves doing their own thing and refusing or not willing to participate with other kids? And that's okay. Like it's not, it doesn't always have to be this, it doesn't always have to be that way. But the observations, understanding a child's behavior tells you a lot, right? Also, how are they in other areas of development? Are they reaching their milestones, such as crawling, sitting, walking? If a child's possibly delayed in that area and they have an underlying global developmental delay, the communication possibly could be delayed too. And that's why it's so important to go to those baby nurse checkups, go see a pediatrician if you're concerned early, because we want to help the child as much as we can. So understanding is a big one. Play is a second one, interactions the third one, and also are they using communication effectively? And when I say communication, are they using nonverbal strategies such as pointing, such as pulling you to go to the fridge or pulling you to go to the car? Are they pushing you? How are they communicating? And is that form of communication age appropriate? And if not, what are they doing? And most of the time, many children are not using single words, and we need to help them do that.
Yeah, so these are things that we should look out for, or if our kids, when they
Mm.
were younger, if they were doing that, it could be
It's
helpful
beyond the
to,
words. It's beyond the
yeah.
words. And I feel like if we really look back, really pull it back to the roots here, child's hearing is so important. If the child isn't engaged effectively or not even responding, what's going on? And a lot of the time, many young children are more prone to getting ear infections because their ear canal is quite tiny. And we want to ensure that their hearing is optimal. And I want to make a comment. Many parents say, oh, yes, my child can hear when the garage door is open and dad's coming into the house. But the hearing level that is required to learn how to communicate is very different to hearing the car driving into the driveway or the TV on. A lot of the time, parents say, oh, they know when Bluey's on because the TV, because they hear the episode. But to learn to communicate, the decibels and hearing frequency is very different to communication versus to what the TV show has.
Yeah, that's such an interesting point. And it's something that I know when my kids were born, they had their hearing tested like a couple days later, but it's not something that is ever tested down the track, at
Later
least.
on, yeah.
Yeah, but you're right.
And
Like,
even here in Australia, we have the vision test before children commence school. They have the vision test, but then don't even have the hearing test. I wish in early childhood care centres they had mandatory hearing tests alongside mandatory vision tests, but I would love them to have mandatory oral examinations, especially a child's airway, because a narrow palate, a high arch palate as well, are red flags for a child's breathing, understanding, attention, and so forth. That's another topic I think though, Hilary. But again, we're saying early a lot in this conversation. The earlier we identify, the better the outcome is for the child.
mhm. And you bring up a topic that I did want to talk to you about. It's that
Mm,
orofacial myology. So a lot of your work is in this,
mm,
and I absolutely love that, especially that you're a speech pathologist. I think all speech pathologists need to be trained in this area. Can
yeah.
you explain a
Mhm.
little bit about what this is and why it's important? It's a topic that
Yeah.
we have had on a number of people talk about, but if people haven't listened to those episodes, a lot of people like probably have not heard this term.
Yeah, yeah. Now, this might be a bit of a long story because it's quite personal too. All three of my daughters were born with a tongue tie, and all of them were released at birth. And I had more challenges with my youngest daughter because the medical staff did not want to release it. But I advocated for my child. I said, look, I know the impact of a child's tongue tie, and she wasn't thriving during breastfeeding. She wasn't gaining weight because she would use all her energy just to suck. Is it hind milk? The first milk, what's that be called? Not the
Oh,
dessert bit, not the fatty bit. What's that bit called? Because the first bit's the protein stuff and the last bit's the fatty stuff. What's that one?
I think is that the high milk,
It's a
the
high milk.
second one.
Yeah,
Yeah,
the
I'm pretty
second one.
sure.
Yeah. So she was so tired. She didn't have an adequate swallow, um, and which in turn then impacted her feeding and was losing a lot of weight. So that was the first point. All my daughters were born with a tongue tie and they were released. Down the track, it's so funny when you're a parent versus a pathologist, like a speech pathologist, like it's so hard to practice what you preach when you're in the trenches of motherhood, and you're taking advice from other mothers, including your own mother, and you just follow what is best. But sometimes, if I could go back, I would change many of my habits. I would feed them soft foods for a while because my daughter had a choking incident and I didn't want her to repeat that again. So my fear hindered her from exploring and so forth. Over time, then I introduced baby-led weaning, which then supported her jaw. However, down the track, my daughter needed orthodontics. So we went to an orthodontist and she has a tongue thrust, my daughter. So every time she swallowed, her tongue would push forward. I don't know if you can see that. And so the weight of the tongue would push her teeth forward, or she would sleep with that in that resting position. So I told the orthodontist, okay, she has this device in her mouth. We know there could be a chance of relapse because her tongue isn't swallowing better. When do I start swallowing treatment? And again, I don't specialize in that. What do I do? She looked at me in the face, Hilary, and said, how will I know? You're the speech pathologist. You should know. In that moment, I became like a raging bull and I was getting my fist pumps ready, saying, who talks to people like that? How do you have bedside manner? Don't speak to me as a speech pathologist. Speak to me as a mother. And I said, but I don't know as a speech pathologist. What do I do? So then I became like do you know what Karens are? In Australia, we call Karens. Yeah. So I became a Karen and became quite bitter, I would say, and spoke to my other speech pathology friends. And they said, we don't know. How would we know? You would need to ask an adult speech pathologist. I said, no, 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 I'm sure. So someone said, oh, you have to see an orofacial myologist. I said, what is that? I've never heard of that. Uh, and I found one in Bondi. So that was about an hour's drive from my house. And I thought, I have to drive an hour every day to see an orofacial myologist for my daughter, but this is my specialty as well. And I swear, Hilary, that day, I don't know, like with the algorithm, a course came up about orofacial myology on my phone. Contacted them, had to wait a year to enroll. I said, that's not a problem. That's fine. I'll start the therapy and I'll do the course eventually. That afternoon, someone cancelled the course and she called me and said, we'd love you to start this course next week. Yeah. So I did the course that weekend, the week following week. And then within 2 weeks, I became an orofacial myologist. And for any speech pathologist listening, it is, especially working with pediatrics, it is vital that you understand this world, especially as our young kids it's a growing epidemic, I would have to say, underdeveloped jaws. And in your industry, Hilary, when we're looking at picky eaters, why? What's going on? Many kids that I see with my own daughter, but also in my caseload, softer foods are much preferred because it's way too hard for a child to chew because they don't have the strength and the resistance and the space for them to chew adequately. And in turn, they're developing poor swallowing behaviors, poor breathing behaviors. And what's happening? These poor kids are really struggling. So that was my biggest turning point to becoming an orofacial myologist through my own children, but to also recognize a lot of these young kids with poor speech production, most of the time it's because of their mouth and their jaw being so underdeveloped and their tongue. And as the child gets older, I found there was an increased diagnosis of ADHD. Why were these kids with small jaws, poor sleep, high arched palates, all being diagnosed with attention difficulties. These poor kids are not sleeping enough. And I'm not dismissing this diagnosis at all. I just want parents to know that let's understand the root cause of your child's breathing and their sleep before we diagnose them with something that could possibly be misdiagnosed by something else. Yeah. And it really breaks my heart because parents don't know. I was that mum. I didn't know, but I have the privilege to know people who know, right? And I feel it's my duty as a speech pathologist to empower parents to know what they can do now when they're babies too, with how they feed them now to support their jaw development, which will significantly help them into their adulthood.
Yeah, it's so good that you're doing that and that you're advocating for this work. It's so important. And I agree. I think it is an epidemic. And that as a psychologist, like you say, working in picky eating, that's definitely one of the root causes of picky eating, but it's also
Mm,
one of the root causes of attention, like you say,
mm,
anxiety too. So many different things. If we're not breathing properly, therefore we're not sleeping properly, we're not able to concentrate, on and on and on. That flow on effect, it affects all aspects of
mm-hmm.
our health and our mental health.
100%. And even if you just know how or what you can do to help your child sleep better, their behavior's better, their engagement's better, and their learning is better. And then we're creating happier, healthier children.
Mhm. And parenting gets
Mm.
easier with that, doesn't
Oh,
it?
100%. And dinners become easier.
Yeah.
You're not then cooking for one child because they don't like red meat, or then the other child only prefers white pasta. Collectively, we can all eat the same meal together.
Yeah, it's so much easier.
Mhm.
So, what are some early oral habits that you suggest that parents do or don't have their kids do ideally?
Yeah. The first thing is, even looking to my own lived experience, knowing the beauty of baby led weaning and when we can introduce, like encouraging your child to say eating a drumstick and with supervision. So all of this is with supervision and understanding that rather than breaking up the little pieces of chicken, how powerful if your child just has the drumstick in their mouth to really help them masticate. So, masticate is chewing and manipulating because all of that is resistance, all of that is building strength. And just to even simplify it, the more chews, the better the outcome. The more squats we do as women, the better our tush would be. Yeah. So, the more resistance a child has, the better their jaw development. So I feel like if we can firstly understand baby led weaning and how we can introduce solids better, that will help get in the trajectory of helping them explore a range of foods, but also building their and developing their palate better and their jaw. Number two, understanding the gorgeous beauty of drinking from a cup, right? The world of marketing, they just know how to tap into mothers' emotions, right? The concept of mess free, no spillage, convenience is all amazing, but it's causing significant harm for our young kids. Why not simply encourage them to drink from a cup? And the reason why I say that, it encourages lip seal on the cup. It encourages proper swallowing, right? And if they're say having a milkshake, if there's some spillage on the side of their mouth, don't wipe it. Let them lick it. Why? Because it builds that resistance and strength in the tongue, but also shows them, how do I clean up around me? Yeah. So drinking from a cup. However, I know we're all parents that go on day trips and drinking from the water bowl is convenient. And that's okay. But it's what you do at home that increases the consistency. It's about consistency, right? So that's the first bit. The second bit, pouches, yogurt pouches, again, and fruit pouches. So convenient, but also so difficult for your child to develop that adequate swallow too. Because if you think about it, if you just imagine your child sucking from the yogurt pouch, you're just doing that and your tongue isn't really working on masticating better. And it's like a liquid diet. and it just falls down to through their throat into their stomach. They're not really having the appropriate swallow. So how about putting the yogurt in a tub, or even having the tub yogurt, putting it in a cup with the spoon? Again, teaches them hand to mouth feeding, adequate lip seal on the spoon, clearing the spoon, moving this food in your mouth, to then ensuring that developing that adequate swallow. So if we can do that consistently with our kids, we are changing our kids.
Yeah, and
Yeah.
those are doable things because our kids do
100%.
eat multiple times a day. It's not necessarily
How many
adding another
opportunities are
exercise.
there?
Yeah,
Yeah.
we can just add that into what we're already doing.
You
So
don't
much
need
more
to buy
doable.
anything. Yeah.
Hmm.
You don't need to buy anything yet, but you can change what you do in your day-to-day basis to help your child out. Yes, it's frustrating. Yes, there's more mess, but why can't children be messy? I think that's another really important topic. We're trying to raise these kids to be young adults. Let them be dirty rascals, because that's what they're meant to be.
Yeah, and I think you're just fighting an uphill battle
You're
if you
fighting it.
don't.
You're fighting it. And you'll have a very costly orthodontic bill in about 10 years' time.
Yeah, it's win-win if you just embrace it.
Yeah. Yeah,
So,
absolutely.
what if there are parents listening and they have older kids
Mhm.
and they're thinking, oh my goodness, I've missed out. I haven't
Mm.
done these things when my kid was one or two or three or four. What do we do later on? And I
It's
know you work with younger
Yes,
kids, but
yeah, that's okay, because there's no cookie cutter answer. Because sometimes these kids may have enlarged adenoids and they're not sleeping properly, or they may have allergies, and all of those actually influence the way that we breathe. So if your child is having trouble with swallowing or with breathing, my first point of call is go to, I don't, in Australia's, there's a GP. I don't know what you have there in Canada, but it would be see a health professional, speech pathologist, and let them complete an oro examination. And then does your child have enlarged adenoids? Do we need to go see an ear, nose, and throat specialist to support them? And in Australia, we have allergies everywhere. So I think it's one of the highest countries in the world with the most allergies. Get that sorted, because if your adenoids are inflamed and if your nasal passage is inflamed, your child can't breathe. So no matter what you do, there's still lots of inflammation. So we need to work on that. Yeah. So first get that on board, and then work alongside the speech pathologist and an airway health dentist or an orthodontist to creating that space needed to help your child breathe better. But with anything, all exercise is supportive. But doing the exercises through an orofacial myologist, including the day-to-day exercises you do through feeding and eating, um, it will all help and support the child out too. So it's never
yeah,
too late, but
that
it
is
just
the
makes
nice
it harder.
message. Yeah, it
Yeah.
does, doesn't it?
Mm.
Was there anything that you think would be really important for listeners to know about speech pathology or oral development that we didn't touch on?
I think the message is anything is possible when you believe and when you actually understand the power of neuroplasticity and how creating a small change has such a vital and remarkable impact to a child. And I feel like I said before, it's never too late to start, but the earlier we start, the better. And there's this misconception in the speech pathology world, particularly with pediatrics, it's all play and all we do is play. But there's so much more to that, because play is the key to child's brain development. And if we can support them through what they're interested in, anything is possible. Anything is possible.
I love that. And just to touch on that, that we can have an impact at any age. I'm going through this with my children, and I personally am working on the myofunctional exercises alongside my children and learning to breathe better through my nose and on and on and on. And even at my age, you can still make those improvements. Now, they're not as big as my children's
Yeah.
because there's so much more capacity for growth of the palate and on and on. But at
Mm.
any age, we can improve these things.
It's funny, when I did the orofacial course, there were many Pilates instructors there. And I asked why it has no relation to children. Apparently, when you work on your tongue posture, it lifts everything up in your face. So, alongside the physical body Pilates, they do orofacial myology in the session to teach women or even men where to put your tongue. And I'm going to model it here. You put it right to the roof of your mouth and encourage nose breathing. Because the tongue is so heavy, all that weight droops a face down, right? So if you're putting your tongue in the right position in your mouth, what happens? Everything lifts. So imagine it's like an instant facelift after an orofacial myology session because everything's just strengthened to lift as opposed to droop.
So not only do we not have to pay the orthodontic bills, but we don't
No
have to get a
Botox.
facelift later on. Yeah.
It's all
Win-win.
about cost effectiveness here.
Well, thank you so much for coming on and sharing your knowledge and your experience with us. I think it's just so invaluable what you're doing. I really appreciate the work you're doing, your podcast, and your time that you've spent with us. Can you let people know where they can find out more about you?
Absolutely. You can just go visit my website, rsspeechpathology.com.au, or just look up on social media, RS Speech Pathology or Wine with Wheater podcast.
And I'll have all of those in the show notes as well. But yeah,
Thank
thank you so
you.
much for coming on. I really appreciate it.
You're welcome, Hilary. Thank you for having me on.